We get a lot of patients that call or we see in regards to their mental health. And a lot of questions that then follow are the medication side, helping with their mental health versus talk therapy. What are your opinions on that?
I think it's really important to really communicate with those patients clearly about sort of where they're at, what their expectations are, how they're progressing at any given time. Often issues are situational and sometimes can be managed by helping the individual recognize the situation that is going on. Sometimes the challenges are a little more complex. They're long-standing, they're genetic or they're family-based and not necessarily treatable by just an initial assessment in conversation. They require the use of pharmacology. Pharmacology can be very, very helpful in helping people control the range of emotions, thoughts, mental processes they experience from their stresses, but it doesn't fix the problem. Sometimes fixing the problem requires a reframing, an education, new coping skills, and that's where something like talk therapy can come into. Talk therapy, I group for the therapists, the counselors, the psychologists who all help provide some insight and training and new approaches to people's challenges, whatever they may be. Depression, anxiety, they're thinking about any given topic that's causing them such mental stress that they're not able to cope with it. Again, pharmacology helpful in the short term just to get you into the right frame of mind to then be helped by talk therapists.
How does one seek out a talk therapist or the realm of talk therapy? Is it a referral? Can they self-refer? Does their family doctor have to send them?
The challenge with that sort of therapy is that it is not covered by Alberta Health at this point in time. So referrals can be made, but it actually makes no difference to them. You need to actually find somebody that you feel comfortable having a conversation with, because you're probably going to have a conversation about many personal very directed towards you type conversations. And if you're not ready to have those conversations with that person, then that person is not the right person to go to. You need to find somebody you're comfortable with. So the first session may be you interviewing them as much as them interviewing you to start.
Is there a recommended frequency in terms of how often, like how much is too much or how little is too little?
I think daily is too much. I think once a year is not enough. Anywhere between weekly to monthly is probably appropriate, depending on the intensity of the mental health crises that's going on.